So just we want to know that your preparation tips for our candidate.
Okay, okay. So, well, I had a little, I wouldn't say little, a lot of blunders in two of my stations, but I wouldn't go in details of that. I would like to emphasize the importance of long clinical consultation. If you are good at that, many of other blunders can be covered. So, what I did was I had a very hectic routine, so I didn't have the time to attend the long sessions. At the end, I was free, but initially I wasn't. So what I did was I took your one-to-one sessions. I took few one-to-one sessions of other mentors as well, just to try. But the best thing about you was that you kept it very simple and very straightforward. And I always say that there is something about your intuition or your gut that never goes wrong. I remember when I asked when is the result, you say it's either tomorrow or it's either on Monday. And I told all of my friends, he has said it tomorrow, it is tomorrow. And so you very well, your assessment of your candidates is very good. I initially I intended to take only 5 to 6 one-to-one sessions of LCCs with you, but you know that once I took the first 5, I took another 5 and took another 5, and you were so curious at the end that I remember you told us that don't count the sessions. I am with you till your exam, and don't worry about the money. And this is something I've seen in very few mentors. I remember I had such pressure on me to pay you, and you was the most chilled out. You hardly as if that's not a problem for you. Your slides helped a lot, sir. Really helped a lot. Um,
Thank you
and
so
your
much.
one they were amazing. Very few people I have seen who have such command in medicine, and yet they equally know how to keep things simple. So yes, I owe my LCs. I had 28 marks in both the LCCs, and one of
Yes.
the LCC was motor neuron disease, and I did it with you few days
Yes.
before. Uh,
Yes.
um,
So
and
good, nice to hear that you passed the exam. Okay.
yes,
Yes.
and when I
So
came back, the day I came back, I was very stressed. So you asked me to call you. I called you, and you took the detail of my exam. And once I was done, as per your assessment is always bang on, you told me, Dr. Hurma, you are passed. Go and relax. And that's what has happened. So
even one station one station without a
I didn't have stethoscope
yes,
on one stage. I lost
yes,
it, and I
but
still can't. And it was a respiratory station, and I still can't believe how did I pass the exam without a stethoscope on respiratory station. So
and that has happened with few candidate also. So I would like to just advise the candidate who are appearing. This mistake should not be happen.
yes, yes.
So, yes, it can be very disastrous also.
Mhm.
Mm.
I just want to I'm not a pro in, like, I wouldn't say I'm the best person to advise, but just one thing which I learned from you, and that is the only tip I want to give all of you. Try to keep things simple, and the things you asked me to ignore, I literally ignored them, and that helped me. Do not just okay, they are assessing your approach, your journal approach as a physician. I didn't probe impact on one of the stations much. And he pointed that out. Like, he told me that you hadn't explored impact a lot. But since my overall approach in that case was very good, they still gave me full marks. So I think it's really important how you approach a case. And now I have seen that one case is clear cut case of a diagnosis, and the other LCC doesn't have a proper diagnosis. It's a case of differentials, and they are entrusted to know all the differentials, and then it's up to them. They can direct or steer the YY in whatever
Yeah.
the diagnosis they want to. So try to be broaden. And second more important thing, that if you have gotten up and you have turned to the YY and you still don't know the diagnosis, don't panic, because if you still don't know the diagnosis, most likely it is a station of differentials. So yeah, that's
Correct.
my
Uh,
feedback.
uh, And now this type of stations are coming
Yes,
in
yes, you,
this type of
that's exact.
differential only.
Yes.
So any advice further you want to give, Dr. Hurma?
Just attend your sessions. And if you don't, to attend long sessions, take one-to-one with you. I was randomly, doing LCCs with you, but in the end, I realized that you were following a proper approach. Initially, I thought that you were just randomly throwing me cases. No, you were following a proper approach. One time you were giving me an acute case, other time chronic, then a CNS case, then a cardiac case, like this. So you were covering presenting complaints in your head, and I didn't know that. I was just following your command blindly. So
Mm.
yeah, have this pattern in your mind. Plus, the best thing about you is you very deeply analyze the feedbacks that you get from people. And if you're not sure, I remember one of the communication I asked you, and you said, Dr. Hurma, I'm not sure. Let me find out. And you only conveyed to me once you collected some feedbacks of the examiners, and you never say something you're not 100% sure of. So that's the best thing. So yeah, at the end, it was just I didn't study much in the last 10 days, but I did used to do once LCC with you, and that just kept my mind at peace. So I'm really grateful for that.
And I also learn a lot from you, Dr. Horma, and in future also.
That's your humility, otherwise, no.
So thank you so much. Okay, and
You're
just about Rawalpindi Center as such, those who are
welcome.
appearing,
Yes.
how they should approach any specific thing about the Rawalpindi Center means Islamabad.
There,
Anything?
I had heard multiple feedbacks, but if you ask me honestly, they were very cooperative and kind. I didn't find any examiner with harsh expressions or not wanting me to go in the right direction. In fact, I'll be very honest, they were very helpful. Had I had failed the exam, that would have been something on my part. And I know too
Mhm.
who unfortunately couldn't make it in the previous exam. And when I asked them, they said the same. They said it was our mistakes, but it is a nice center. At least I would say that. Not at any
Okay.
point they kind of bothered me or something.
Hmm. And what about your opinion about many candidate telling about books and notes, how to means how to approach?
I wrote there are okay. I would like to say that try to approach cases now in terms of presenting complaints. Like, right, I remember I wrote 25 to 30 presenting complaints, and I used to practice with you and Dr. Ikra, one of my friends here. She's here. She's a legend. I would want to. So,
I kept her in the second number.
yeah, she's amazing. I have no words for her. So the presenting complaint, 80 is 10 to 11 questions of that particular presenting complaint. And then my friend or you, whatever diagnosis you gave me in the end of that patient, I would do that diagnosis. Normally read from, I mean, Rider Mead and uh, cases for PACES I touched, and Dr. Imran Babar book I touched a little bit, but I read from the older version. That's all I did. And then yes, I used to listen to whatever your feedback was very carefully. And the slides you used to show me, I'm sorry for that. I just used to read. That's all I did.
Okay. So thank you
Mhm.
so much, Dr. Horma, for coming and sharing your experience.
You're welcome. You're welcome.
Okay,
And
okay. So, anything else you want to add? And anything about your opinion about cardiology station?
okay,
Something is.
cardio a lot of findings in my case. It had a lot of findings, and they kept on actually. Okay, so I'm FCPS cardiology, so I didn't want to be over efficient, because that's what I. So I gave them the basic findings, and then they probed me, and then the moment they kept on probing me, I kept on giving them the findings. If they probe you and you give the finding, they don't deduct your marks, they give you the marks, they want to give you the marks. Just one thing I would like to say, never create a finding that really bothers them. Like,
Abs-
then they cut marks. So if there's seven findings, you have told four, and the rest of the three, they have, extracted those out of you, totally fine. I got full marks. No problem at all. But don't create something that isn't there.
few candidate they did it and they are they got I think more than 140, but they fail in the physical sign. So physical
Oh,
sign you have to be very particular. Don't make any sign which is not there.
yes.
Hmm.
Not.
If you miss something, no problem, but don't
Yes.
make.
Don't. then they would cut. If you miss something, 4 findings, you missed one, no problem. If you created something, now it's a must, they will cut the marks.
Okay, Dr. Murma, thank you so
Thank you.
much. Okay, before Ikra, one Dr. Safna want to join. She has a duty from 4 p.m. So she just have few minutes left. So
Sure.
she just texted me. That
Sure.
Yeah, hello, sir.
hello, Sapna. Many
Yes, sir.
congratulations.
Yeah, thank you so much, sir.
How you are
Yeah,
feeling now?
yeah, I'm relieved, sir. Feel like a big chapter of life is finished.
सारी एग्जाम है वो खुद तो पास किया ही होगा मैं जो पढ़ा रहा है लोगों को
I think
नहीं
somebody's speaker is on.
Yes. Just a minute. I will try to mute them all. Just a minute. I am not able to mute. Okay. So continue, Sapna.
Yes, sir. Yeah, I feel so much happy and relieved. I feel like a big chapter of life is finished. Yeah, because I was more than 6 months I was preparing, and between the duty, like 9 to 6, I had duty, and from then, soon after duty, I used to come run and sit in your class, and then till 9:30, 10, we have class regularly, right?
So I still, Sapna, remember you that when you stop while presenting the case.
Yeah, yes, sir. I did not have any idea about this communication and consultation before I joined your course, and I still remember, like, during one or two communication stages, I was stopping in between and asking you, sir, what should I do?
So just
And the
share
next
your.
day you will message me. Today I will do one session with you, 1:1.
Because I am worried about you. Okay,
Yeah.
so yes. So just
And
talk about your center, Kochi center. How was the center, and particularly those from India?
yes,
Uh,
sir. Center, everything was fine. Examiners were very nice. And just before starting the exam, two examiners, they came and talked to us. They were telling that, don't be tensed. Even if you lose one or two station, it's okay. Uh, they are telling, like, even if even if you fail, no problem, you are going to improve only. And all that, two of them came outside just before the exam, and they were telling us all these things and giving instructions very nicely. And at every stations, there were assistants, like nurses were there. If the patient was not understanding any commands, the nurses or assistants were helping. Communication also, they were translating.
Okay. So just give your advice and tips how to prepare for this exam and how.
Yes, sir. Yes, sir. For regarding communication and consultation station, sir, I have attended only your course, and then I referred to Alrox. That book is there, no? Alrox book I was going through, and then I have not attended as participant or listener in any other mentors, but I just attended one or two like free sessions, no? When the other mentors are conducting some free sessions, I have attended that, but as a regular candidate, I have attended only yours. And as the previous doctor said, like, you keep the classes very simple and up to the point, sir. Though it is simple, it is up to the point. Because at the exam we see that they are not like diving into deep things. They are just asking superficially only. Because only that much time is there, no, for the questions. And communication stations, both communication I have scored like total just 1 mark I lost in both communication. And consultation station, one station I lost 2 marks, and other station I lost 3 marks. And I think Kochi stations, some cases are repeating. Like my one clinical consultation case was a case of disorientation in a patient who is on dialysis, on having a fistula. And I think almost same case came in the last diet also.
Yes, yes. I think we
Yeah.
discussed it also.
Yeah,
no?
we discussed the exact case we have discussed also, sir. I think the last diet they said it's a case of confusion.
Mhm.
And the other clinical consultation was, sir, systemic sclerosis. Patient was complaining of bluish discoloration of hands and breathing difficulty. So
This disorientation, what you are talking to the surrogate? No. So
yes,
he,
sir.
what he is telling, his main complaint was that he is still disoriented, or in
Yeah,
between.
yeah. But in some stations, the surrogates are not able to give exact answers. In such cases, like if Indian examiners are there, they are just like helping out the surrogates to tell.
Oh.
Yeah. They are telling like a disorientation since a few hours, not recognize and able to recognize people like that. Like speech is not, he's not speaking related things like that.
Okay.
And systemic sclerosis, they the case they were asking like what are the causes of breathing difficulty in a patient, and if the this bluish discoloration is not better with calcium channel
What was the
blocker,
complaint,
what
doctor?
is it?
What was the
Sorry,
complaint? What was the complaint from outside?
systemic sclerosis patient. So outside the complaint was patient is having bluish discoloration of hands. And also breathing difficulty. Breathing difficulty since last 5 years. Bluish discoloration of hands since last 1 year.
Okay.
So the patient is already taking calcium channel blocker. So what are the other medicines that you can give the patient? That is what they were asking. And what are the other causes? What are the causes of breathing difficulty in this patient?
Oh,
So I
systemic.
said like, yeah, fibrosis, pulmonary hypertension, such things.
Okay. So
Then
both cases was good.
Yeah. Systemic sclerosis, I think, sir, we had discussed a case as dysphagia.
Yes.
Yeah. Then communication, like one case, I think it has come in other centers also, like the Parkinsonism patient when admitted for pneumonia. There is a medical error of not giving the regular Parkinson medicines.
So you did it as a medical error, man?
Yeah, yes, sir.
And you got full marks? Or
Yeah. I think 1 mark less.
1 mark less. Okay.
Yeah. Then the other case was newly diagnosed case of patient presenting with seizures, and CT shows temporal lobe lesion. And so we have to speak to the patient regarding arranging for MRI and giving the patient other instructions like driving restriction and all that.
Okay, Sapna. So thank you. Okay. Thank
Yes,
you so
sir.
much, because you have to go, I think, for the duty
Yeah.
Yes. Thank you
Other
so much
cases
for
also
doing.
very like straightforward cases. CVS we had mitral regurgitation. Then
Okay.
rest was fibrosis. Then CNS was little difficult, sir. Like it was like lower limb one side, like knee jerk and all were exaggerated, but plantar was mute and such a little confused case.
Was
So
well done, doctor. Very good. You
yeah,
did it. Okay.
yeah, thank you.
And
Yeah.
what about offline course? I think you did Osler course.
Yes, sir. I did 2 courses. Like one past the paces I did in the beginning. But at that time, I did not have any idea about all this. Like even before starting the preparation, I went and joined for the course. So my advice to the candidates is like, if you have done your half the preparation, go for one offline course, and then once
Without
you're near,
preparation, doing offline course has no sense.
Yeah, because I did not have any idea, and it's like only a 4 days course, and you cannot like learn anything in 4 days course.
No one is going to teach you. If you
Yeah.
you
Yeah.
have knowledge, then only you will learn.
Yeah. Like it is a the course is for those who have learned. It's an opportunity for you to present the cases. So yeah, and in the offline case, you should not stand back. You have to move forward and go and take turns and attend cases, like present cases. And one course, it is better to near to the exam also, sir. That will be of great help. I did oscillars near to my exam.
Yes. So once you
Yeah.
have orientation, then only you will get benefit.
Yes,
Otherwise,
yes, yes.
taking offline course is of no benefit.
Yeah, yeah.
Hmm.
And also these, then book-wise, I said, sir, I did not go through Rider and all. I just went through cases for paces and Alrox. Then I went through this pass the test videos and all that.
This is
Yeah.
for PhD is very good book for those who are preparing. It's a 190-page book, and
Yeah, yeah.
you can finish it within while you are on the duty. So it's a very good
Mm-hmm.
and covering everything
Yeah, yeah.
and authentic knowledge also. So it's very good.
Yeah, yeah. Yes, sir.
So thank you so much, Sapna.
Yeah, yeah. Thank you so much, sir.
So,
Okay, okay. Keep in touch, sir. Okay.
okay. So now, Dr. Ikra, are you there? Then
Yes, sir, I'm
we-
here.
uh, sorry, Dr. Mahar, after Ikra, we will talk to you.
No issues.
No, no.
No
So,
issues, sir. No.
many congratulations, Dr. Ikra. You got very good
Thank you
marks.
very much, sir.
Yes.
Thank you very much, sir. As I was telling you, I was just amazed how your prediction was almost accurate. So although I wasn't confident about myself, but you were more confident, and you just kept telling me that you will score good marks, and you kept telling me you score 160, and Alhamdulillah, I've got good marks. And
Yes, yes.
I'm really
So
thankful to
now,
you.
so today you have to tell why you lose these marks, 4 or 6 marks.
So I lost 4 marks in the physical science and 2 marks in the physical examination. So
Hmm.
I think I will wait for the feedback. I'm still not sure about the physical science. I think in the respiratory case, I got 18 out of 20, and the respiratory case wasn't straightforward. I still not sure what I told was true or not. So it was there was tracheal deviation to one side, and also there was reduced breath sounds in the lower zones on that side on the So it was going against the collapse. So it was going against the effusion, but in favor of collapse. So I said collapse as my first differential, and then I said that it could be fibrosis, but there is no other supporting sign. And then as Dr. Hurma was just mentioning that the examiners were actually guiding. So the examiner, so I think there
Correct.
someone's mic is on. Okay, so the examiner asked me that what other differential could you give for decreased breath sounds and dull percussion. Also, I said effusion, and it could be a mass. So the Viva was for effusion. So, and it was I think it was a post TB lung, because it was a young patient, otherwise healthy looking. So I still am not sure. I'll share the feedback with you,
Hmm.
but Alhamdulillah, I just passed the exam, so that's what matters in the end.
And you have
Alhamdulillah.
to tell how you managed to get such marks. Okay. It's not a easy
Uh,
task.
so for the communication and the LCCs, I took one-to-one sessions with you once I got the seat. So I got the seat 2 months before the exam in the waiting list. So I was in touch with the preparation before that as well. I took a course when I applied for Diet 3 earlier. Then I took a course, a month course with the other mentor. And after that, I was in touch with the preparation. But once I got the seat, I would say that the whole dedicated, preparation starts only after you get the seat, after your seat is confirmed.
Hmm.
And meanwhile, so after that, when I started one-to-one courses with you, so from the very beginning, you were very encouraging. So you had confidence in me. I would say more than myself. So that is
Actually,
the best thing about
bef-
you.
before starting of our session, you fix a goal for me, and I have to achieve that.
Yeah, and you did that. So
And I am so happy that
Alhamdulillah.
you achieve your goal. Very good, very
So I was struggling with time management even during our sessions.
nice.
During the LCCs, I was struggling with time management, I would say, and I kept the watch with me. And in the first station, I that was station 4. I forgot my watch in the abdomen station where I was performing the examination, I kept my watch on the table, and then the examiner stood in front of the table. And then I got out and I realized I don't have my watch, and the next station was LCC. So, but the practice that I did with you and with my colleagues, so that really helped. So even before, without the watch, and I didn't look at the clock. It was, not in front of me. It was on the side. So, but Alhamdulillah, I did manage the time very well. I was
And
able to finish in time. Yeah.
and credit also goes to your partners. Okay, I think you got.
Yeah, definitely.
Yes, yes.
Yeah, really, thanks to Dr. Hurma, particularly for the clinical stations. So
Yes.
we did the clinical practice together for the last month, and I think we were going to the hospitals for consecutive 10 days. That was very hectic at that time, but that really paid off. And I thank you to Dr. Hurma for her kind remarks. I'm really humbled.
Yeah. So very good. So just tell us the tips regarding how you achieve 28 out of 28 in communication consultation. Any tips for our group candidates?
So for the consultation, as Dr. Hurma also mentioned, and you keep telling us, the approach really matters. And sometimes we waste time on some unimportant questions and unnecessary questions, so that really costs us time. Even while practicing, I did notice that. So I think I took the history quite up to the point, and uh, it was a rheumatology case. It was a joint pain case of knee joint pain, and the
Your
patient
voice is breaking.
was non-rheumatoid
Dr. Dr. Ikra, I think your
arthritis.
voice is
So I
breaking down.
did
Dr. Ikra, I think your voice is breaking.
presenting complaint and the rheumatological history.
So can anyone confirm about Dr. Ikra voice is breaking or is from problem with my side? Hello, Dr. Ikra. You can continue, doctor.
Oh, yes, sir. I lost the connection.
Now so your voice is clear.
Okay. So in that case, after the knee joint examination, I moved on to the hand examination for rheumatoid deformities and the other rheumatoid examination. But I think I missed to check the rheumatoid nodules. So during the viva, the examiner, I would say, was very kind. He told me that you didn't check for rheumatoid nodules. I said, oh yes, I didn't specifically look for rheumatoid nodules. Then he said there were no rheumatoid nodules. I said, okay, there were no rheumatoid nodules.
So
So the
it was a
examiner,
case of rheumatoid arthritis with lung fibrosis.
no, there was no lung fibrosis. It was a flare of rheumatoid arthritis with involvement of knee joint.
Okay,
So
okay.
I ruled out the septic arthritis, reactive arthritis, gout, and I
And,
kept the differentials. I kept those in differentials.
and she has a rheumatoid deformity in the hand.
Yeah, that was a male patient. He had Buttinia deformities in both
Uh,
the middle fingers, I guess,
and
and there
she's a
were no
known
other
case.
signs.
He's a known case.
Yeah, he was
Uh,
a known case, and he was taking the treatment sulfasalazine, hydroxychloroquine.
okay,
The surrogate didn't mention the diagnosis. He showed the medication list, and that was for rheumatoid arthritis.
okay.
And the
For how,
other LCC, yeah.
for how long he has rheumatoid arthritis? Any idea, doctor?
I think I'm not sure. I don't remember, but the patient was 35 or 34-year-old male
Okay.
patient, and it was a no. I think for 4 years or maybe more.
Mhm. Okay, okay.
So there were no other associated findings in lungs but I did perform the lung examination, the cardiac examination.
Mm.
And in the other case, the other LCC, as I told you that I was very much worried about that LCC. That was a patient with fever. He
Mm.
had a history of fever for 2 days, which was now relieved for 1 day. And then there was for past 1 day he had difficulty in closing one eye. So from the
Mm.
presenting complaint, I knew that it could be Bell's palsy or it could be facial palsy. And
Mm.
all the vitals given were normal. He was afebrile at the moment. So,
Mm.
and I did one case of facial palsy with it was a case of Ramsay-Hunt syndrome with you. So I
Mm.
was outside. Outside, I was pretty much relieved that okay, I know the case. When I went inside and I examined the patient and I took all the history. So there was a travel history of the patient was his profession was actor, and there was a travel history to US. So
Mm.
I couldn't establish the link over there between Lyme disease, and I didn't explore much. But the examiner then asked me what are the risk factors for facial palsy, and in the risk factors in the causes I mentioned Lyme disease. And
Mm.
then I didn't remember the treatment or the further details of Lyme disease, but I did mention the MDT, and I remembered the case that we did that whenever there is infection, so I'm going to treat the infection, involve the infectious diseases team. So I think that saved me. I got 26 in that case.
Mm. But still you are able to manage it. Otherwise, it's a very difficult case. It's a, even means you cannot imagine Lyme disease in consultation station. So credit
Yeah,
goes.
and infectious diseases is my weak part. I'm never confident about infectious diseases. So that's why I told you that I was very much worried that I messed up one consultation. So what is going to happen now? But I think they wanted to listen to the differentials and
Good
the
thing is
overall
that
approach.
you ask the travel history.
Hmm. And
Mm.
I think I out of the other candidates in my carousel, I think because others were saying, oh, it was just a case of Bell's palsy. So I
Mm.
I just wonder that maybe they didn't ask the travel history, because then the examiner particularly asked me that did you ask the travel history? What was the travel history? I told him, and he also asked me what was the profession of the patient. So because I had asked those questions, so I was able to
Ah,
answer, but I was
otherwise,
baffled after that case.
otherwise everyone will think like that it could be a Bell's palsy. Okay.
Hmm.
You did not
I
take it.
also mentioned Bell's palsy, but and regarding the treatment, I think I mentioned the treatment for Bell's palsy, and just because he kept probing me about Lyme disease, so I said that oh, yes, we would treat the infection, but I didn't know the specific treatment. I couldn't remember at that time. So, and my last station was station 3, cardiology and neuro. And I did the same mistake as Dr. Hurma. I left my stat in neuro station, but thankfully that was my last station.
Yeah,
So after that, I know
actually,
I
you
said
know
that
it about Horma incidents before.
yes, yes, I knew,
I
but
warn you before. I warn you not that keep the aestheto. Uh,
yeah, after coming out, I was like, oh, thank God, it was my last station, and I knew that how Dr. Hurma, forgot her stats, because in neuro station you don't need the stats, so you put it
yes,
aside, and
yes. You are lucky.
after the
Otherwise, about
Alhamdulillah, yeah.
Horma loss in the respiratory station is very difficult.
Yeah, respiratory we can't be sure of anything without our stats. And in the cardiology also my case was it was a complicated case because others some few other candidates of my carousel that I talked to, they were saying some other findings and my findings were a little different. So that's why I told you that I'm not sure about my findings. But
Mhm.
Dr. Hurma, thanks to Dr. Hurma again, she being a cardiologist, she really helped me in cardio.
Yes.
We went to yeah, we went for cardio cases together, and I was telling her that you told me about the mixed aortic valve disease, that is whenever you hear such a sound in such and such sound in such and such findings, the apex beats such, so it has got to be a mixed aortic valve disease. So
correct.
I just had that in mind. So thankfully it was correct.
I told Dr. Horma that you can manage cardiovascular system without a stethoscope also, but respiratory difficult.
Yeah, that's definitely difficult.
Thank you so much, Dr. Ikra.
Thank you, sir. Thank you, really,
Oh,
for your guidance and for
So,
your prayers as well.
okay, so just
Thank
stay
you.
here. Maybe someone want to ask. So you can reply in the chat box, Doctor, if
Okay.
some.
Okay, sure. Okay,
So
thank
I
you.
think Dr. Mahar, are you there? Dr. Mahar, are you there? I think it's a Salah time, so he might has left already. Dr. Mahar, are you there? I think he left. So anyone else is there? I think Dr. Rahman, are you there? So if anyone there, just unmute yourself. Till we can ask others to ask questions if you want to ask question to Dr. Ikra or Dr. Horma regarding the exam, anything, any questions you want to ask, she is here to help you. Dr. Mahar has left. I think it's a Salah time for him. He texted me. So due to Ramadan, this timing is also not difficult to manage for other candidates also. So anyone want to ask questions to Dr. Ikra or Dr. Horma, you can ask. I think Dr. Mahar is there. Or...
Hello, sir.
Hello. Many congratulations, Dr. Mahar.
How are you, sir? I'm very happy to listen to hear your voice again.
Yes, yes. We are very happy about your result. And you are
Thank
the
you.
youth center. Very rare to find candidate from your center.
Yes, yes. Thank you, sir. Thank you so much.
Okay, we are very happy, and I think Dr. Musab also will join, but he's on the duty. His duty will finish at 8 p.m. So tell me, Dr. Mahar, about your experience about the exam, how about our candidates, and
Yes, sir.
about your center also. You have a very good story to tell.
Yes, yes,
Very nice story. I cannot believe it.
yes, sir. I want first to thank you for your effort. The course was very beneficial for me and for all of us. And thank God we passed this stressful exam. For me, from the first attempt, it was very important to so the headache released. And as you know, after 7 years waiting, I got a seat for the first time. So it was important for me to pass. And I want to tell everyone that to pass this exam, you have to have prepare for how to manage time, and this is very important. And you don't need a deep knowledge to pass this exam. What you need is to practice and to divide your patient to
Yes,
field.
this patient, Tahir, he doesn't receive.
Hello?
Continue, Doctor.
Yes. And for me, yes, I will tell you about the center. I was, I was feeling some stress before exam because I went there. I asked my friend who's working there, and he's one of the team, and he told me no need to bring anything, only your stethoscope. I went there. I found that there is no torch, and I don't have torch, and I feel more stressed before I start the exam. And then I started with the long clinical consultation, and when I found one of the local examiner, she was a female doctor, and she was very toxic with me. So I feel more and more stressed, and I was about to leave the exam. But anyway, so I had after that a neuro station which I lost because of this problem. So my advice to all of you, if you fail one station, forget about this and just continue the exam, relax and continue. Because the only thing is in this exam is you have to practice to manage the time, because you don't have time to prove yourself. You don't have time to talk about all your knowledge. So all information should be on your spine, and they will not ask you any deep knowledge question. It's only very simple question. So don't complicate things. Make everything very easy. If you complicate any case, you will be in trouble. And you can divide the exam to talkative station and short station, which you will not talk. And the talkative station, which is the communication and long clinical consultation. So the course with Dr. Huda is very important and very beneficial, and it will be enough. I don't advise you to read many books. Knowledge is good because you will feel more confident if you have good knowledge. But no need to read multiple books. You have to know something from everything. Don't try to know everything, because they don't have time, and they are, by the way, the examiner not always are good examiner. I mean, they don't have that knowledge, and sometimes if you tell them something they don't know, they will be upset and they will detect your marks. So this is my main advice, but I will tell you about my experience. Yes, I got full mark in communication skills, two stations, and one full mark in the long clinical communication. The other one, which was my third station, I got only 22 marks. So the problem in the center that examiner in general, they were good, but some of them were very good. The good examiner will guide you to the diagnosis, but the bad examiner, he will try to mislead you and detect your mark. So the most you need to pass is a good center, good exam. I remember in the abdominal station, which I got a full mark, but I missed one of the very important findings, which was, but I did not notice.
Just a minute, doctor. Just a minute. Sorry, doctor. I'm not able to unmute one also. And now continue, Dr.
Yes. So in the abdominal station, I got a full mark, but I despite that, I missed one of the important finding, which is a pallor. Patient had a pallor, but I could not detect because patient had a jaundice at the same time. So I did a very good discussion with the examiner regarding differential diagnosis. He was very happy. And at the end, he told me, "Did you notice any pallor?" So I told him, to be honest, I did not notice. Patient has jaundice, and the room was dark. So I told him maybe he has a pallor, but I could not detect it. So he was very happy because I was honest with him, and he gave me a full mark. So and at the same time, I know one of my friends, he's an examiner in other center, and he told me there was a very tough examiner from UK, and he there was one candidate in the long clinical consultation. He missed to ask about the family history. Despite that, the family history was negative, and it was not affect his differential diagnosis, but he gave him unsatisfactory. So sometimes if the examiner is not good, even if you do everything, you might lose the station. So you need to be well prepared, especially regarding the time. and you have to practice more than to read. So practice and practice, find a
Practice.
partner and practice, because with practice you will not miss your scheme, and so you can easily in the exam, because this exam is not logic. Even if you pass this exam, that does not mean that you are a good doctor, and if you did not pass, that does not mean that you are not a good doctor. It's not logic to see 8 cases, 8 patients in like 1 to 2 hours. And as I mentioned to you just for fun, sir, in the communication, I had a case about 15 years old girl with a query brain mass. And so she gave me like 6 concern. I did not have time to ask her any question. I don't know why they gave her all these concern in 10 minutes. But I answered all. I got a full mark. And one of the concern was that she wants to go home. She does not want to stay. I asked her, may I know why you want to go home? She told me because of my kids. So I was shocked. She's 15 years old. And I asked her how many kids, how the age of the kids. She told me she has 3 kids. So I did not ask her why you have 3 kids in this age, but sometimes they don't know the scenario. That surrogate, I have also another type of stress, that all surrogate were my assistant working with me in the hospital. So especially in communication, it was very difficult not to mention jargons, because daily I do rounds with them and teach them, and I know that they are doctors, so it's difficult to talk to them in a simple language. But yes, sir, the course with you is very, very important, because you covered everything, mashallah. And also, we know how to manage time. And so my problem was in the short cases, actually. And in the neurology station, I don't know why they detected my mark. They gave me only 5 marks out of 20. Yes, despite that, I did a full structural examination. They did not give me the marks of examination. I was shocked. But anyway, I passed all skills. But sometimes you don't know. So please, if you felt that you are not good in a station, just don't think about it and continue. And you don't know.
Station don't matter much. If you did very well in consultation, communication, and other clinical stations, one station even went very bad, it is not going to affect you much.
Yes, yes. I remember, because when I went to the first clinical station, I thought it was the examiner was very tough. So when I went to the second clinical consultation, I felt that I need more time to examine the patient, because in the first one I did not examine. There was no time. And I remember that you told me try to increase your speed. So what I did, I felt that I need more marks in the physical examination at identifying the physical signs. So I stopped early the history after I got the diagnosis. And then I did a very detailed examination. Examiner was very happy, and she told me, mashallah, you did very well before I leave. And she gave me a full mark. So you need to be well prepared in regard to time. This is very important. Time is very important. But and believe me, I know if they gave you 3 minutes more for each case, everyone will pass.
Correct.
I told him, sir, please let me. What happened, sir, in your case? The patient was very non-cooperative patient. So he misguided me. He was not sure about his impaired sensation. Every time he was changing, so I lost the time before I finished. I did not have time to examine cerebellar and the gate also. And I told him about this, the examiner, I want to complete my examination patient. And please, if you can, let me examine him again. He was very tough, actually. But other examiners were very good. And the cases was very clear. And the cardio stations here, it's, I'm an interventional cardiologist. So I decided before to go to exam that I will not discuss in detail the cardio cases, but I could not, because this is my habit. So the case was very clear. Patient has mid-sternotomy scar with metallic sound, second metallic heart sound, and he
So,
has ejection.
so for you, a metallic heart sound is nothing.
Very good.
Easy.
So it was very easy for me, but you know what happens here? When and there was also mitral regurg murmur, very clear, and thrusting apex, soft S1. Everyone was very clear for me because this is my job. So when it started the discussion, I told him about the mitral regurg murmur. Then he told me what could be. I told him it's a mitral regurg. He told me any other possibility. I told him it could be a Gallivardian murmur. So he started asking me about Gallivardian murmur in details. So we finished the station without asking any question. He was asking me only about it. And he detected my marks, 3 marks. I don't know why he detected. I was very confident, and I told him there is also a diastolic murmur, which is most probably it was a Graham Steele murmur, secondary to pulmonary hypertension. I think because I was discussing like this, he detected my mark. He was not happy to hear all these details from me. He's not a cardiologist, by the way, you know. But anyway,
So he detected the marks of a cardiologist in cardiology.
yes, I was when I saw my mark sheet, I was shocked only because of these marks. Others I don't care. But anyway, I passed at the end, and this is the most important thing, to relieve and relax, and because you know, sir, and if you repeat this exam, your stress will be more and more.
Yes, it's very difficult. Means financially, also mentally, socially,
Very stressful.
wise
Very,
also.
yes.
It's not easy thing to repeat anything. Means this exam is not only like a theory exam. So those who
Yes,
are
sir.
prepared well, okay, don't take it easily this exam, because you will lost money, and you will feel depressed also, okay, and
Yes.
you will also suffer. So it's very difficult to manage. It's not easy thing.
Yes, so my advice to prepare very well, take the exam seriously, and go in the your first attempt to pass, not to do like a course. Go to pass and be confident, and you have to go well prepared for the time. This is because you in the exam you will not feel the time. For 6 minutes you will not feel it. 4 minutes discussion, they will ask very superficial, very simple question, and they don't they are not waiting for you to answer question in detail. They want one word only.
Correct.
So time is very important. Practice with a partner. Do courses. I advise everyone to do a course with you. Sir, I did only the course with you. And
Thank you.
for short cases, if you don't have patients in your center, I advise you to go for a course also, online course. Because same cases in all exam, it will be the same cases. They don't have cases.
Same case.
Same cases, yes. Just practice how to present the case, and don't mention diagnosis. Always mention a differential diagnosis.
Yes.
Believe me, they will guide you to the diagnosis. If you included your differential, and this will be enough.
So this exam is all about differential, actually, not about
Yes.
diagnosis. Diagnosis should be one of the out of this 4 or 5
Yes,
differential.
because it's not logic to give a diagnosis only by examining the patient.
Examining the patient. Even clinical station, you are not taking history also. How you can do
Yes.
it? It's not
Yes.
possible.
Yes. And sir, to all candidates, I am ready to help. They can text me anytime in the WhatsApp. I will be happy to help.
Thank you so much,
Doctor, where is the center of this?
Kuwait, doctor.
Where?
Yes, Kuwait.
Dubai?
You want
Yes, Kuwait.
Kuwait?
Yes. Kuwait center.
You want to know, Dr. Hassan, anything about Kuwait Center? Dr. Mahar will help you. Hello. So thank you so much. So thank you so much, Dr. Mahar, for taking time. Okay. And
thank you, sir. I am very happy to hear your voice again.
Okay. Very nice to hear about you. And good, I am worried about your time management and you did very well. Okay.
Yes, sir. Thank you so much.
You're welcome,
Okay,
doctor.
Dr. Hassan, can you consultation cases? Just can enumerate what is that cases?
Yes, along clinical consultation, both cases were rheumatology. First case, which is with the toxic examiner, it was a very clear case. Psoriatic arthropathy, patient has the case outside, patient has hand swelling. So I found the patient with very clear arthritis, joint swelling. So directly after I asked about all questions regarding the pain and the type of joint pain, it's inflammatory type of pain. I found a morning stiffness and resting type of pain. So I asked about skin rash. She told me, yes, I have skin rash. I saw the rash. It was extensive in the behind the ear, scalp rash, and also on extensors. So it was very clear it's psoriasis. I asked some question about SLE and rheumatoid, which is the main differential diagnosis. So there was no oral ulcers, no rash after sun exposure, no photosensitivity, and no hair loss. And also there was no alopecia, no scarring of alopecia. But the examiner, she was very tough. Why I did not ask about malar rash? I told her, say, Madam, the patient, the SLE is one of differential, but it's less likely. She told me, why less likely? She was very aggressive. I don't know why, but I know people here, they are acting like this. So I told her, because this is the rash on the scalp, there is no scarring, alopecia, and also she has deformity, usually SLE, even Charcot arthritis. If she has deformity, she will be correctable. I try to correct, it was not correctable, so it's unlikely. She does not have any photosensitivity. And she was still insisting that it could be SLE more than psoriatic, and she was misleading me. But the diagnosis was psoriatic arthropathy. Then at the end, she told me, what's your diagnosis? I told her, my diagnosis is psoriatic arthropathy. She told me, you are insisting? I told her, yes. And it was psoriatic arthropathy. So, but the second case, different examiner. She was very polite, the local and the external examiner. And it was a case of outside, they gave me a case of double vision. So I suspected that, okay, very, very good. I will find that the patient has Turner palsy or myasthenia or anything. But I found a patient who has rheumatoid arthritis for 10 years or 7 years, I don't remember. And she has Sjogren. So the nice thing in this case that patient, I asked her when she, I asked all questions. Then I asked her about any eye changes. She told me like what I told her, dryness or redness. She told me, yes, I have severe dryness on my eyes and on my mouth also.
Okay.
So I
Very
got
nice.
the diagnosis. So she asked me about all differential. In such case, I gave full differential like Graves, as a patient has autoimmune disease or all autoimmune possibility, Graves disease, myasthenia gravis, and mononeuritis multiplex. I found in the examination that patient has an isolated lower motor seventh nerve palsy. So I was the only one in the carousel who detect this. So she was very happy, and I know that the surrogate. I told you she is my assistant.
She had lower motor neuron type of seventh cranial palsy also.
Yes, yes. So the surrogate was my assistant. She told me she was very happy after you left. She told, "Mashallah, this is the only candidate we detected," and he did very well, mashallah. And she gave me full mark. Despite, sir, I forgot to ask about driving.
And it was double vision.
It was double vision, but during examination there was no double vision at all.
Okay. So that save you. Okay. Yes.
She told me, does she have ophthalmoplegia? I told her no. Does she have double vision? I told her no. But the history there was double vision, so maybe she had before and now she improved. So mononeuritis multiplex still a possibility because she had already seventh nerve palsy. So she was very happy when I told her like
And
this.
she has diabetes or anything? No.
No diabetes.
Okay.
And sir, I want also to highlight one thing that okay, we read about when you they ask about management, non-pharmacological, pharmacological, general, and specific. During exam, they might ask you only one question. So she asked me only one question. She did not ask what's your management. She asked me patient on methotrexate. Already she was in methotrexate. So she told me, do you feel that she has methotrexate is enough for her? Because during examination, patient has a very clear swelling and hotness, and she has signs of active disease. So I told her no. So just she told me what treatment you will give, not the management. So I did not mention any non-pharmacological. I told her I will add another disease-modifying drug, anti-rheumatic drug, and I will watch. If no improvement, I will add biological agents. She was very happy. Despite that, this is not our job as a general medicine, but she was happy that she gave me the full mark. I was lucky because if
So she has rheumatoid hand also.
sorry.
She has rheumatoid hand also.
Yes, she has rheumatoid has very clear. I was very lucky because there was multiple physical signs which I detected. Otherwise, I will fail this
Yes,
domain.
it's a rheumatoid arthritis. She is telling dryness also. A dryness
Yes.
of the both eyes or one eyes.
Both eyes, yeah.
Okay, so it means Sjogren also there and Bell's palsy also
Yes.
there.
Yes. Yes.
It's very
So, and
complicated.
this case helped me to pass the domain of physical science.
Physical
Because
science.
if I failed in this, I will fail in the exam also. So
Okay.
that's why try to take your patient as a skills, not the whole case. Because I noticed that I was not good in the physical in the first case, and also I lost the neuro, so it was my station to actually share last 4 stations I got the full mark. So just because when you start to
Just because of one station, you get disturbed. Okay, so this is the thing.
yes. But thank God, it's very important to prepare well to pass from the first attempt. Especially say that they did not give me a seat in the next exam. So
Yes,
fail
if
in the
you,
exam and don't have a seat for a long time will make you more distressed, more
yes,
stressed.
and you also left the practice and everything. Again, you have to restart everything. It's very difficult.
Yes, sir. Especially like my case, I'm a cardiologist, so it will
So
be
your branch is also totally different. It's very difficult.
yes. So prepare yourself very well and take the course. I advise everyone to take the course with Dr. Hoda. It's very good course, structural course, and Sarah, during exam, I remembered you multiple times. So this is very good, and you will remember something which, if you didn't practice during the course, you will not remember during the exam. Because even if you did everything, you might miss something. And some examiners, they are very tough. If you miss something, they will fail you. But others, they will see your approach. If your approach is good, so they will give you full mark even if you miss something. So you have to be very well prepared, and with the grace of God, you all pass, inshallah. And try to choose a good center.
The center you pass is the good center. That is the thing. The center you fail is become a bad center.
Yes.
Yes. The main thing is the luck that day favor
Yes.
you. So this exam is 30% luck also. Sometimes your mind clicks. Okay. So thank you so much for joining, Dr. Mahar, and taking your time. Okay.
No problem, sir. Thank you so much. Thank you for all your effort and
I think
support.
Dr. Rahman is there. Dr. Rahman.
Yes, sir.
You are also the same group member of Dr. Mahar.
Yes, sir. Yes, sir.
How you are feeling now?
Sir, actually, after a long time, after failure of several attempts, I have passed. So it's for me, it's special feeling. I can't express in words.
Congratulations,
I can,
Dr. Rahman. Sorry for interruption.
I can
Congratulations.
say that without your help and guidance, I think I would have not passed. Because not only you have always encouraged me and always spoke the good words, encouraging words, which encouraged me to sit for the next exam, despite failure of earlier attempts. So always I remember you, Dr. Huda, and I'll recommend every member to take such course to get the confidence before exam. So regarding exam, may I start to tell, sir?
Yes, you can tell briefly, just tell.
Okay. So clinical consultation 1 was hypothyroidism. My center was Bangalore, and it was fast carousel. My first case my clinical consultation 1 was hypothyroidism. It was 28 years as a female patient, and typical feature of hypothyroidism, that is weight gain, weather preference, also dry skin, brittle hair, everything, and menstrual problem. So I ruled out other possibilities in history, and I did the relevant examination. And also the examiner asked me a few questions relevant to hypothyroidism. And in that station, I got 28 out of 28. Clinical consultation 2 was slightly different. A 27 years aged female patient was there complaining of generalized pain, body ache, tiredness, sleepiness for last 7 months. She was suffering from migraine for a long time, for which she used to take naproxen infrequently. She actually worked in a multinational company office job, so she had a lot of work pressure. She was feeling low, for which she went to GP. GP has prescribed amitriptyline 10 milligram BD. She was taking only that medication for last few weeks, but without no benefit. Examination was entirely normal. Possibly it was the case was surrogate.
So how much you got this case, doctor?
How much?
Marks?
Marks I got in this case 27 out of 28.
Oh, it means your diagnosis was correct.
Yes, I gave the diagnosis. First diagnosis I gave depression. Second diagnosis I gave chronic fatigue syndrome, and third diagnosis I gave fibromyalgia. Discussion was entirely on depression.
Very good. So this case is not easy case. Not an easy
Yes,
case.
sir.
When you told me about this case, I was also was a bit worried, but alhamdulillah, you got 27, so it's very good marks.
Yes, sir. And communication 1, it was first seizure, first convulsion. CT scan showed a suspicious tumor in temporal lobe, right temporal lobe. Consultant wants to do MRI brain, and it was just counseling. So the patient, the surrogate, repeatedly asked that I am a driver. How can I want to drive. I'm the only earning member of the family. I think it's cancer. That means end of life. Please give me some medication to prevent future feet, like that. So in that station, I got 14 out of 16.
Okay. Very good.
Another communication was lupus nephritis, needs kidney biopsy. But in that case, she interfered me a lot. That means whatever I am talking, she's taking upper hand and she's keeping on talking. So I got the less opportunity to explain. And whenever I am trying to draw a diagram, she's asking another concern. Actually, the surrogate was not well trained, I think. In that case, I got only 11 out of 16.
Out of 16.
Communication 2. Respiratory was good case. It was most probably idiopathic pulmonary fibrosis. Discussion was differential diagnosis and the management investigations. I got 20 out of 20. Abdomen was renal transplant.
Very good.
Typical case, but I couldn't. It was typical case. There was AV fistula in the left arm, no recent piercing mark, no sign of any immunosuppression toxicity. There was no sign of any fluid overload, but I couldn't feel the mass in the right iliac fossa, kidney mass. So I spoke the truth that I expected a mass, but I couldn't feel it. Possibly because of that, examiner has cut 2 marks. That means I got 18 out of 20 in this station. And cardiovascular, I said it's mitral regurgitation. My first differential will be mitral regurgitation. My second diagnosis will be mixed mitral valve disease, that is mitral regurgitation along with mitral stenosis. But I couldn't appreciate mid-diastolic murmur, though I have got the loud S1 as well as opening snap. So the entire question was on mixed mitral valve disease, and I got 17 out of 20. So I think this was a case of mixed mitral valve disease, but as I missed mid-diastolic murmur, that's why they cut 3 marks. Yes, I think so. And neuro case, I got actually a middle-aged patient. He was lying on a bed, and the posture was typical of stroke. That is right-sided straight leg, and the hand was in flexion position. So I thought it's stroke. I was asked to examine neurologically. So I started from the legs, then upper arms, upper limbs, and then face. I got the pyramidal type of weakness only on right side, but left side was entirely normal. And there was no sign of stroke in the face. That is, 7th nerve was totally normal. So I gave the first diagnosis stroke. Second diagnosis, I gave Brown-Sequard syndrome. But I couldn't, I didn't get time to perform the sensory. Okay. That's why the examiner asked, what sensory findings will you get in Brown-Sequard? Then I told that if there will be ipsilateral loss of joint position sense, vibration sense, but contralateral ipsilateral loss of joint position sense and vibration sense, and contralateral loss of pen temperature. Then the examiner said that he has the pen temperature sensation opposite side. That means that was not Brown-Sequard. The questions was asked entirely on stroke, but I got only 14 out of 20. I don't know what has been happened in this case.
So good.
That was my
doctor. Very good. Means consultation station you did very well.
Yes, sir. Yes, sir. And only that is only because of you, and you trained me in such a way. Before exam, I was very fluent in taking history as well as examination. So I think that has helped me a lot in clinical consultation.
I still remember when you left the group after the result. So don't get disheartened. It happened, doctor. Okay. Ultimately, you deserve it, and you will get a degree. Okay.
Yes,
So
sir.
okay. So you already a past candidate. So don't get disheartened by the result. Sometimes luck not favor. Okay. So you will not pass, but if you deserve it, ultimately you will get it.
I want to offer you my sincere thanks and regards, sir, because I can't forget your help, your words forever, sir. You are not only a good teacher and good mentor, but you support mentally so much that the PACES candidates get the energy and oxygen to sit for the next exam, especially those who failed repeatedly earlier. And I I recommend to those who failed repeatedly to take your coaching.
You teach me one hadith I also still remember. So this is all about getting knowledge from transferring knowledge. Okay, you transfer
Yes, sir.
something to me, and I also transfer something to you. Okay, so this is
Yes, sir.
about everyone has some good qualities. Okay, so
Yes.
it's all about learning. I am also learn something from you. Okay, and that hadith will be always there with me forever. So, so thank you so much, Dr. Rahman. Okay,
Thank you, sir.
just pray for us. Okay, and we'll meet in Kolkata anytime in coming.
Okay, sir.
Oh, sir.
Thank you, sir.
It's fine.
So, thank you so much, Doctor.
Thank you, sir.
So, I think anyone there, Dr. Meetu?
Yes, sir. Yes, I'm here.
Many congratulations, Dr. Meetu.
Thank you, sir. Thank you
How
so
are
much.
you?
I'm feeling good. I'm feeling relieved.
I am very happy to hear your voice again after a long
Yes, sir. I
time.
know. I know.
So thank you so much for coming to our free
Thank you,
session.
sir. I just wanted to say thanks a lot to you specifically. I had the same cases as Dr. Rahman, so I'm not going to get into all the cases. It'll take very short time. Just want to say, I had been a listener in your course, and then because I didn't want to become an active participant because I was very shy to talk. So I asked you for a one-to-one session, and that benefited me a lot. Both my long case and my communication, I've scored full marks. So it's
Thank
just,
you.
yes,
Yes.
it's only because of you. Yeah.
Thank you, Meetu.
Because there's a definitive pattern which we have to follow. And that pattern, they are expecting that pattern, especially in communication. If you're breaking bad news, the sentences which we are supposed to say, like, do you want somebody there? What do you expect from the meeting? All these things are supposed to be said. And on the day of exam, we are very tensed. We don't know what to ask. So we can write it from outside. So you had told me, use the time when you're sitting outside, write it down on the paper. So I wrote down everything and then I went in. So I had exactly the same cases, which Dr. Rahman said. So everything I had spoken, everything she was very convinced. For biopsy, the surrogate was very happy. She said, I'll definitely go for the procedure. So the examiner was also happy. And the other communication was, we have to convince them for an MRI, which I think he spoke about. It was an episode of seizure and CT scan was taken. So we have to convince them for an MRI. So she kept asking me, do you think my tumor is cancerous? So I told her the tumor can be non-cancerous or cancerous. So yes. So all these points, we should write it down from outside and then go in. And even for long case, I remembered all your points, whatever you had told me. So it was easy.
Thank you so much.
And I just want to tell everybody, please consider taking up Dr. Huda's course at least 2 times if you can. He will help you out in all possible ways. I mean, including financial aspect. Let me please assure you about that. I mean, I'm not encouraging it, but if anybody is having some problem, please tell him about it. He will see to it that you finish out all the cases, and he will not ask anything like that. So may God bless him for whatever he's doing. Let him start a big, huge academy. That's what I sincerely wish. God bless you, sir.
Okay. Thank you so much, Amity. So
Thank
just
you.
Amity, can you advise our candidate how to approach your view? Your view, tip, something special you want to give, anything you think you
Sir,
can give.
just when if you're a beginner, just start by reading OST, Gautam Mehta and Rider. If you can't finish it, it's okay. Then take up your course. First, become a listener. Listen to what everybody is saying. People who have repeated, people who have experienced failures. Listen to the points which they are saying. Write it down in a piece, in a book. First, become a good listener. Listen to what everybody is saying. Write down all the points. Then become an active participant. You can figure out your own mistakes. I don't think any other book is necessary because you have already covered all the recent cases, the points. That is more than enough, sir.
Okay, thank you, Mitu.
Thank you
so
sir.
much, Doctor, for coming and sharing your thoughts. Okay.
Thank you, sir.
Thank you, Mitu. So I think anyone there, Dr. Musab, I think Dr. Musab has duty. So if anyone there, our candidate who it's difficult to.
Sir, I want to tell one thing. Recently, one book has been published for immersive PACES, written by Dr. Muhammad Ali. The name of the book is Role Play in MRCP PACES. Role Play in MRCP PACES. It is available online and can read in Kindle, Amazon Kindle. It is very nicely written. The communication and all the long cases and also the systems, very nicely written, especially for the beginners. This is excellent book.
Okay,
Role play in MRCP PACES, written by Dr. Muhammad Ali.
Okay. It's
Role
available
play
in
Amazon Kindle edition.
Okay.
Soft copy is available. At last 1 month I read it. It's very nicely written.
Okay, very good. So thank you for sharing this information. Okay, it might help someone. Okay, and I think it's a cheap also. How much price?
Cheap also. Yes, sir. Cheap also.
Very good. So thank you so much, everyone. I think no one is there now. Still no one left. Dr. Musab has duty. So I think, and it's a Ramadan time, so it's very difficult to take time. So we will have another session. Those who missed today, we'll try to tell him to join in our another session. Okay. And we have our regular courses and one-to-one courses. So any one of you wish to join early. Okay. If you wish to join early, it will help you and you will able to understand what about everything about the PACES. Okay. So try to, if you have a time, okay, it usually done in the evening time as per the India or Pakistan time. So night time, I think after 8. So all of you are welcome to join our course. Okay. So thank you so much everyone for joining our session today and all the candidate who came here and expressed their wishes. So thank you so much. So I will end our session today. If anyone has any questions, you can ask in our WhatsApp group, and the rest of the candidate are still there, so they will reply you. Okay. So everyone is there to help you, those who are preparing for PACES. So thank you so much, doctors. So I will end our meeting today.